everybody. So today we have this topic. We'll be covering penile fractures. What is a penile fracture? Penile fracture is the fracture of your penis. If this is your penis, it might get fractured, and that's called penile fracture. No big deal. So you remember, it's a urological emergency. So when you think about penile fracture, think of it as a urological emergency. The idea is you have a blunt trauma to your penis, and that is when it's erect. So blunt trauma when your penis is erect usually happens in cases of sexual intercourse. It's not really something like a trauma which is induced on you. It's just an accidental trauma. So sexual trauma is usually the most common cause. Now what exactly happens, let's try and understand. So I'll take you to a picture here. So this is the picture of your penis. This is the cross section of your penis. You can see this is a flaccid penis compared to an erect penis. So the idea is this area of your penis, this is called the corpus cavernosus, which is not filled with blood. So these are the cavities which will be flooded with blood, and this is your urethra. Now the idea is when you have parasympathetic stimulation, these arteries, these are the deep arteries, they get vasodilated because of a parasympathetic system, and blood oozes out into this corpora cavernosa, and they are filled with blood, and that makes this flaccid penis go erect. So if you can see here, there's a lot of blood here, and this blood is taken out of here using emissary veins. This is one of the emissary veins, and that's how this normal functioning happens. Now when you have an erect penis and there is a sexual trauma here, sort of a trauma, your traumatic, your penis sort of goes through trauma here. The idea is this layer kind of break. There's a break in this fibrous tunica albuginea. So this is called tunica albuginea. This layer is called tunica albuginea. So this is the layer which is called tunica albuginea, and this kind of breaks open, and you have blood coming out, oozing into the whole penis, and that's going to give rise to formation of a hematoma, as you can see in this picture. So this is hematoma, and this is a classical penile fracture picture that you'll come across. So this is penile fracture that you see, and this is the repair going on. We'll talk about it. So the idea is this corpora cavernosa, this breaks loose, and blood comes out of it, and it fills this whole area. Now so the understanding here is when a patient like this comes to you, the treatment for this patient is going to be urgent surgery. So you urgently you do the surgery of the patient, and what is the surgery is you repair this defect. So you sort of aspirate whatever blood has come out, and you repair this defect, and that's the treatment. But one must understand that because let me just wipe it off for you to make it very clear, is that because this whole arrangement, this whole setup is close to urethra. This is urethra, as you can see. So because this whole arrangement is close to urethra, you can have impingement of urethra, and you can have urethral issues as well. Sometimes the fracture actually can involve the urethra, and that is why you might have to do a urethral repair. And whether or not you have to do a urethral repair to check it out, to beforehand know whether you're going to be doing stitching the urethra also in place, you have to do something called investigation called retrograde urethrography. So urethrography, the word tells you urethrography, and retrograde is you're going from opposite side, like the urine usually flows anterograde. You're going opposite to the flow of urine to look at the urethra. So what are the indications for doing this urethrography? So the indications are, first is blood at the meatus, because that shows that there's a connection between the urethra and the blood here. So this blood, if you have blood at the meatus is here. This is called the meatus. So if you see blood at meatus, meaning this blood might have sort of percolated from here and come to the meatus, and that is one of the indications you might do it. Hematuria, obviously that blood is now frankly flowing from here. Dysuria, because there's hematoma formation here, so you're not able to happily easily pass the urine. And then urinary retention, because it's so large a hematoma that you're having urinary retention here, as you can see. So these are the 4 indications. Now some of you might think that when you have a case of penile fracture, we might want to go for things like a suprapubic catheter placement, but that is a wrong option. The idea is you have 2 types of urethra fractures. You have a posterior urethra fracture and an anterior urethra fracture. So posterior urethra fracture an anterior urethral fracture or injury, I'm so sorry. So anterior urethral injury. The idea is for posterior urethral injuries, because you're going to be having surgical issues, it's a result of surgical pelvic fractures. So in that case, you're going to go for suprapubic, placement of a catheter. The reason is because you need to decompress the bladder until the urethra can be repaired in cases of posterior injuries. In case of anterior injuries, you don't really have to do anything. You can do intra-op catheter placement while you're repairing the urethra, and this catheter can be left in place for post-operative protection of repair as well, and that actually does away with your your urethral, your penile fracture. So let me sum it up for you. So penile fracture, the whole idea is you have a blunt trauma to the penis when it is erect. Usually it's going to be sexual intercourse, and then you have rupture of the tunica fibrous albuginea, due to which blood sort of extravasates into the periphery. You can also injure the bladder. The treatment is going to be an urgent surgical repair of the tunica albuginea, which is the mainstay. The diagnosis for penile fracture is clinical, so that's to be kept in mind. Usually you have around 20% cases of penile fracture will have urethral injury alongside, and the indications for that to look at the urethra is going to be blood at the meatus, hematuria, dysuria, urinary retention. If the urethral injury is confirmed by urethrography, then the urethra is also repaired at the time of surgery itself, and that does away with your penile fracture.